Welcome to another True North Talk. My name is Andrew Lawton, fellow with True North, and wanting to turn for this edition of the program to healthcare. This has been an issue near and dear to my heart for over a decade. I've had my own very negative experiences within the Canadian healthcare system, and I've covered a fair bit about some of the battles we see going on in this system. But there was a really fascinating report that was just published this month by secondstreet.org looking at the sheer number of Canadians who have left the country to the United States for healthcare, or leaving the country in general for healthcare. And I found this to be an important number because I think that healthcare is oftentimes a blind spot for Canadians. We assume that just everything's fine, everything's hunky-dory, but for a lot of Canadians, that isn't in fact the case. I want to bring into this discussion the president of secondstreet.org, Colin Craig. Colin, good to talk to you. Thanks very much for your time today.
Well, thanks for having me, Andrew.
So tell me about this report here. You found the top line number here, 217,500 Canadians left the country for healthcare in 2017. Did you go into it really with a specific number in mind where this comes and you think this is high or low or about on par with what you anticipated?
It was higher than what I thought, just based on some of the previous estimates that had been out there. The previous ones that I've read have been cautious. And, this figure that we were able to calculate doesn't come without its own limitations, too. So, 217,000 people, specifically indicating that healthcare was the main purpose of their trip in 2017. That's a lot of people. And if you think about it, if you're watching a Blue Jays baseball game at the Rogers Center there, and you imagine that place completely sold out, well, we're talking about at least 4 sellouts of the Blue Jays stadium. That's a lot of people. If you think about Barrie, Ontario, the greater Barrie, Ontario area, I mean, it's more than that population. It's more than Kelowna, British Columbia. So, it's a lot of people when you start to kind of really think of it in that perspective. And the way that we got the data was from Statistics Canada. And what they do is they will survey Canadians when they return back to the country. And they'll ask them questions. And one of them is, well, what was the main purpose of your trip? And healthcare or medical reasons is one of the possible responses. So we said to Stats Canada, okay, can we get some data? How many Canadians are reporting that? And so that number that you and we just talked about, the 217,000, that's on the low end. That figure doesn't include Saskatchewan, Newfoundland, Prince Edward Island, or Nova Scotia. And the reason is because for those provinces, the sample sizes were a bit small. And so Stats Can said, here's the numbers, but we would caution against using them because you have to be careful. So we just said, okay, well, we're not even we won't include those. So it's actually higher. And for some other technical reasons, it would be higher too. So that's sort of the low end. At the higher end, it's around 324,000. So, to use the Rogers Center example, that'd be 6 sellouts of a Blue Jays game. So we're talking about a heck of a lot of people that are getting in their cars or getting into airplanes and leaving the country for healthcare. And, just note too, that's just patients.
Yeah, and that works out to be, I think, just shy of about 600 a day as well. So we're not talking about an insignificant number here. And more importantly, I think it cuts to that issue of what do they need to go over there for? And I know that you're looking at the numbers, not the rationale, but I know that you've also done some supplementary research to this, looking at some of the stories of people that have gone. And I'm wondering what those key reasons are, because some people would say, oh, it's just impatience or something like that. But have you found there's actually been a rationale that you've been able to find is common, or at least more common than others?
Yeah, and I'm glad you mentioned that, because that is one of the limitations on the data, is that we have the numbers, we don't know the why. And, Stats Can says, well, why are you going? Or what was the purpose of your trip? But it doesn't say, well, what type of healthcare are you receiving? So it's quite possible that some of those people left for dental. We've heard of cases of that where someone goes to another country for dental care because they can get a better deal. In some cases, some people are probably traveling for a procedure that's simply not offered in Canada. So I think of the MS treatments that some people were going to Germany for. So that would be an example. But those are anecdotal, and we've certainly heard a lot of cases where people are going for things that are offered by the Canadian healthcare system, but the waiting lists are just too long. Hip replacements, knee surgery, MRI scans, lots of things like that, where Canadians are kind of hitting this wall in our system. And then they look around. So the government's saying you're going to have to wait a long period of time, and they look around and there's no private companies that offer it or are allowed to offer it, because quite often the government in Canada will restrict private clinics from offering a lot of procedures. So then they think, okay, well, what are we going to do? We're going to have to leave the country for healthcare. And so we've seen a lot of examples of that. I've been talking to lots of different Canadian patients, hearing their stories about going off to Mexico and China and the United States and Thailand and Poland and so forth. It's happening. And the stereotype that people will say is that, oh, it's just the rich doing it. Well, obviously, if you got a lot of money, you're not going to wait in line for a year to get your hip done here in Canada. So the wealthy are already doing this, but we've talked to a lot of middle-income Canadians who are scraping the money together to go and get faster healthcare because they don't want to wait in pain for a year. They don't want to wait for months and months and months while a disease is potentially spreading throughout their body. It's very unnerving. And when it comes to your health, a lot of people put it first and they do what they can to make it happen, to improve their situation.
I'm glad you mentioned that line about the rich, because you're right. And I've heard that a lot. People say, oh, it's just the rich doing that. But that doesn't really explain the need for it. I mean, sure, the rich might be the only ones that have the opportunity, but the rich and the poor and the middle class are the ones that are all dealing with that fairly equal problem that is incentivizing that behavior, even if not everyone is embracing the behavior.
Yeah, and that's a very good point, is that if the system was running as well as people like to suggest, then even the rich would wait a couple of weeks or maybe a month or whatever to get their procedure done. But the bottom line is it's not. We've seen a doubling of waiting lists in terms of the length of time that people are waiting. According to Fraser Institute data, they've been looking at the situation for 25 years, and that's the big picture. Waiting lists have doubled. And certainly we've been talking to lots of Canadians in different provinces and hearing stories of people being told it's going to be a year, sometimes 2 years. In the case of Jenny McKenzie, we did a little video. We put it on our Facebook page and YouTube and website and all that. And we talked to her about her experience. So she's a senior citizen in Vancouver, and she was told that to get her hip operated on, the total amount of time that she'd be waiting would be upwards of a year or 2 years. And so in the meantime, this was a lady who had a very active lifestyle before her hip problems really began. She's a senior citizen that, tried to get in her, I think it was 10,000 steps a day. She said, she'd go to the gym regularly. She liked to go out to go to Spanish lessons and meet with her friends for coffee and so forth. She had grandkids that she liked to babysit and watch that. So she had a very active lifestyle. And since her hip problems have began, now she's largely confined to her apartment. It's very hard for her to get around. She walks with crutches. She's living in pain. She's been prescribed medication. I mean, it's incredible that governments will ration healthcare and they think that it's okay to just leave people on a waiting list for a year or 2 years or whatever it is. So there's lots of stories like that out there. And, in her case, she couldn't afford a private hip operation, but certainly when you allow those procedures in the country, some people will decide they'll pay out of pocket and then they come off of the waiting list and someone else gets bumped up. So, that is the standard approach in most countries is, you have that option where you have the public healthcare system and you have a private system if people want to choose. And countries that do that Canada competes with, their healthcare systems have better results. So,
and I know you mentioned it before, but just to reiterate, this isn't just going from Canada to the U.S. This is theoretically anywhere in the world, correct?
Yeah, it's anywhere in the world that people are going.
But there is still, I think, for people that live near the border, probably an easier time getting to the U.S. And I wanted to touch on a little project you did with Chris Sims, who I'm sure a lot of viewers will be familiar with. You actually took a road trip to Bellingham, Washington, which is not far from Vancouver, not far from Abbotsford, BC. And it was interesting because you went to a medical center, and I saw the video. You're going around finding all these BC license plates in the parking lot. And I live about an hour from Port Huron, Michigan. So I see the Ontario plates in the Olive Garden and the Walmart parking lots. I've never gone to the hospital to look in their parking lots, but it stands to reason I might be able to replicate your results. But you were seeing this just on an ordinary day, no advanced knowledge, Canadians that clearly, for some reason or another, are at a U.S. medical center.
Yeah, exactly. And, it wasn't the most exciting of road trips. It wasn't like a stag do over the border, but I had a great time. Chris is a great person to to work with, and we
Yeah, I can
decided,
imagine the border guard. Purpose of your visit, we want to look at license plates in a hospital parking lot. But okay, sure.
yeah, not the most exciting of trips, but yeah, it was good. We got up at the crack of dawn and we left and got in a car, and we didn't know what to expect. We thought, well, let's see. So we drove down to Bellingham, Washington, and like you say, we drove around the parking lots. We tried to be careful because there are some staff parking lots versus patient and that. So we tried to think, well, we don't want to look at the staff side, and we did actually see some Canadian license plates on the staff side, including one in a physician spot. But yeah, in the patient side, even on the street, we saw lots of BC plates. And just to be clear, this was a healthcare campus, or a major complex kind of thing, right? So if you're in the middle of this thing and you've got BC plate, well, it's not like you're parking there and you're at some store across the street. It was all healthcare, different types of clinics and so forth. And we tried to talk to a patient, getting into a car with a BC plate, but unfortunately, we just didn't see any. So we did look for that. We're unsuccessful. But what we did find is we went into one of the clinics that we talked to a lady there, and we said, well, this is interesting. We're seeing lots of BC plates. Do you get a lot of Canadian patients coming down? She said, oh, yeah, a fair number come down, and they go for, I can't remember what procedure it was now, but, they receive a certain type of healthcare at that complex. And, it's sort of anecdotally what's backing up these big picture numbers that we've uncovered, and that is that there's a lot of people that are crossing the border for healthcare.
So I guess the last thing I'd ask you then on that is that given this number lacks, as we talked earlier, that specific motivation for why each of those 217,000 have left, what is the real takeaway that you take from this research or you want others to?
Well, we kind of looked at this as an economic opportunity perspective, because every time someone leaves the country for healthcare and pays for a procedure in another country, money is leaving our economy, and it's a lot. There's the cost of the procedure, for starters. There's the cost of transportation to get to that country, whether it's just over the border in the US or whether you're going to Thailand. I mean, there's a varying range of costs there. There's accommodation costs. There's also the cost of food and lodging. There's a lot of different expenditures that go into these trips. And we thought, well, just how big is this opportunity if Canadians had the right to choose to pay out of pocket for those procedures in Canada? And like I said before, I mean, you could maintain the public healthcare system, but just give people this option so that they could choose private care, which in many provinces, that's not the case. So I think there's a real economic opportunity. And just as food for thought for your viewers, we talked about how many patients are leaving. Well, in many cases, patients don't go alone; they go with a spouse or a loved one or a friend or whatever the case may be. So you've got even more people that are having to pay for food and accommodations and travel costs and so forth, outside of the country. And so that the numbers get even higher, and people can see them if they want in our report. But that was really what we were trying to do, is just to take a look at this through an economic lens and see how much money is leaving the country every day for healthcare, how many people are going, and what type of opportunity that might present for Canada.
Yeah, and obviously I have no basis for this number, but even if each of those people was investing, say, $10,000 overall, I mean, we're talking about billions of dollars a year, and then over the course of several years that's being spent outside of Canada. I think that's a great point you raise.
Yeah, and so we do have a few numbers in the report, and it's a bit tricky because, like I said at the beginning, a lot of the numbers and data that's out there, it's not complete. So we have some data on how much Canadians are spending a day in other countries on healthcare. It's about $1.9 million a day. But those figures wouldn't include some of the other activities that people sometimes do on a healthcare trip. And that is that, if you're getting open heart surgery, you're not going to a rock concert that night, right? If you're in another country. But if you're maybe you've got a sore shoulder and you're going to get that looked at, well, you might do some shopping afterwards, right? Because you can still walk around and do shopping and function in that, or maybe you go to a baseball game or whatever abroad. So those costs aren't included. But yeah, there's an economic opportunity there for Canada to keep some of these dollars here, and even potentially become a medical tourism destination. Lots of people from around the world are going to the US for healthcare because they think of it as good and quality. Well, Canada's got a good reputation as being a country that's, a first world nation with high standards for lots of things. So, there's no reason why we couldn't become a healthcare destination, and that could drive all kinds of innovation in the healthcare world.
Great perspective. Colin Craig joining me, president of secondstreet.org. Secondstreet.org, of course, where you can find this, and we'll also have a link up at True North. Colin, thanks so much for your time and really great work on this.
Okay, thanks a lot, Andrew.